Excellent. Just a heads up, of course, this session is being recorded and being live. Sorry, don't know how I got dropped, but I am back. Good afternoon, everyone, and thanks so much for joining. Happy Tuesday to you as well, Nikki. This is our third session for Mental Health Month. We have a series of 5 sessions all up. Very excited to have you here. Now, I know people are just rolling in at the moment, and so as always, I'm just going to give a few introductory remarks. We haven't quite started yet. We'll try to start as close to 1:05 as possible. Just to let everybody know that this session is being live streamed on YouTube as well, as we have been over the last 2 weeks. So if anyone you know might be struggling with getting into the Zoom meeting right now, a link to the Zoom meeting has currently been posted on chat. Feel free to send that link to them and they'll be able to see that straight away. Also, because it's YouTube, that would be saved as a recording via that channel as well. And of course, a link to the recording to these sessions will be made available on our website right after today's session. Again, while we're waiting, I just want to get us started thinking about today's topic a little bit by looking at a few quick questions. So if you'd like to share on chat in response to the question as to 1, what industry are you in at the moment? And 2, how busy do you feel like your workplace is at the moment on a scale of 1 to 10, where 1 is so quiet, you're absolutely bored, to 10, it's incredibly busy, you can't imagine it any busier, and 5, maybe just that comfortable in between. And then to follow up on that as well, let us know if you're feeling overworked or underworked at the moment. A few responses already. Excellent. Oh, I didn't expect it to be busy looking at breeding horses. That's amazing. Fantastic. Keep those rolling in. I'll just give you a quick heads up as well. There is a Q&A section as part of this as well. If you do have any questions today, feel free to put them on in the Q&A section. And I've got a member of team who's going to be monitoring that as well. DCJ 10, stress but good, fantastic. Some high scores. I haven't seen too many low scores actually. Veterinary industry, aware that you guys are quite busy a lot of the time. Sports and recreation, a comfortable 5. I love it. Now, I will be giving a few more minutes before we start, but let me just quickly introduce myself. My name's Eddie, and I'm the program lead here at WayAhead Workplaces. Just quickly, here at WayAhead Workplaces, we work to connect individuals and educate people within organizations with a goal of building happier and healthier workplaces as well. So really excited to have Kevin join us today and have you all kind of joining us as well. Some great feedback here. Thank you so much. All right, so let me just quickly start on today's session then. Before we start, in the spirit of reconciliation, I do want to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay respect to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. Welcome again to week 3 of our Mental Health Month series, where we're going to explore how we all have a role to play in workplace wellbeing. Now, over the last couple of weeks, we've heard from Dr. Natalie Flatt from Superfriend, introducing the different groups in and out of the workplace that play a role in our mental health at work. And then we had Elizabeth Shaw just last week, the CEO from Relationships Australia in New South Wales, explore the impact of interpersonal connections at work. I'm really excited to introduce to you today Kevin St Mart from the OPUS Centre for Psychosocial Risk, exploring the huge topic of job demands. Kevin has an unbelievable amount of experience and expertise in the workplace and mental health and psychological safety. He's worked with large and small public and private organisations, including Beyond Blue and Comcare, the National Work Health and Safety Regulator, and has been involved in the development of the People at Work risk assessment tool, as well as started helping with the launch of the Australia's Mentally Healthy Workplace Alliance. We're so excited to have Kevin speak with us today, so I'm going to pass over to you and turn off my camera.
Excellent. Thank you so much, Eddie. I really appreciate it. And thanks everyone for coming along. And so thanks so much for your engagement so far. It's been great to see all of the engagement. I'd also like to acknowledge the traditional custodians of the land on which we work, and currently working on the land of the Wurundjeri people of the Kulin Nation, and welcome their elders past, present and emerging. Also extend that welcome to people of all cultures and identities here today. So today we are talking about overwork and underwork, some major psychosocial factors, and part of what the OPUS Centre, the organisation that I currently work for, looks into and helps organisations with. So we help to make sense of the psychosocial risks and hazards within people's workplaces, helping them through dealing with the new regulations and managing those with an evidence base. So let's get into this. There's a lot of overwork and underwork out there, and we've just seen in the webinar chat that there's plenty of people that are feeling a little bit overworked, and there are some there that are underworked. And we see that that quote there, 71% of Australian workers claim their bosses expect too much work from them. That stat is actually from 2006. So it's from a while ago, and it's a survey of about 2,000 people, and they found that 42% of people don't have the staffing, the IT support required to do their jobs efficiently. So you can only imagine what it is like right now. And I'm sure many people are feeling that things have gotten a little bit worse over time. So let's get into that. We will be looking at firstly the impact. So the impact of underwork firstly, and then overwork. Then we'll be looking at also the solution. So what can we do, and especially in that workplace environment, what can we do to help with overwork or underwork? And then we'll do a little bit of discussion and asking some questions out there to yourselves. So let's get into the impact. So firstly, underwork. Really, underwork, when we talk about underwork, we're talking about becoming chronically bored. And it's really to the point that your jobs become totally meaningless, doesn't really add value. And sometimes we call that bore out, where you're feeling really bored versus burnout. So that chronic boredom. And we don't want to mix that up with just short bouts of boredom or rest periods in between heavy workloads. It is ongoing boredom and not feeling that your job, or feeling disengaged from your job. It really leads to a couple of things. It can lead to disengagement with your job, leading to turnover. If people are feeling that they're not contributing much to their work, to the organisation, they're more likely to leave. It leads to reduced productivity as well. So if you're feeling like you're bored, you're really not going to put in that 110% effort to doing other things within the workplace. And we also know that the research has shown it can lead to depression and anxiety. Now, there are three aspects to underwork and bore out, I guess. And if you're feeling all three of these, it's probably going to be underwork. So firstly is around lack of work. So not having enough actual work to do in the first place. That obviously will lead to underwork. But then there's the lack of growth. You might have enough work to do, but you're not feeling that you're getting some growth out of that work. You're not feeling that it's challenging you to the point where you're actually learning, you're actually getting better and using your skills. Finally, there's lack of purpose. Really understanding what role you play and how that that goes towards the greater purpose of the organisation or the team that you work with. And purpose is a really interesting one because this is becoming more and more of a request, I guess, for the younger generations coming through. We know that previous generations before the baby boomers really working towards that security, that financial, that primary security. Then we saw the next generations working towards status and making sure that they've got good jobs, they've got that security. Next generations work towards organisations that were looking for good collaboration between people. And we see that with the movement of putting people first, or putting people at the centre of the services and products that we actually put forward within workplaces. And then finally, the new generations coming forward, the Generation Z, are really looking for purpose in their work. And it's very similar to Maslow's hierarchy of needs. So we talk about Maslow's hierarchy being, firstly, people need that physiological piece to feel good. Once you've got that, you can move on to safety, making sure you've got that security, making sure you've got that status, then moving on to belonging and love, feeling a part of something, and then moving on to esteem, which is that respect from others and by others as well. And so in looking at this and researching this for this particular topic, I thought, I wonder if there is a new hierarchy of needs for that Generation Z. And I did find this hierarchy of needs for Generation Z. Wi-Fi at the bottom. This is my only joke, by the way. But what I wanted to really talk to you about is that really, we have to be mindful about these needs for the different generations within our workplace, but also the new generations coming up. It is around that, those having respect for others, having that connection, contributing to purpose within the workplace. So if you really want to get that Generation Z motivated and working, then having that purpose is a really important point. Let's go to Overwork, because I think that's where a lot of people were in the chat there. So with Overwork, there's been a lot of studies, especially recently after the pandemic, around overwork and around burnout. Globally, McKinsey and Company did a good study in 2021, saying 48% of workers report burnout. And it's 61% in Australia, and you can see the stats on the right-hand side there. We've also seen some more focused studies in Australia and New Zealand by Microsoft in 2022, and they found 62% of workers and 64% of managers were feeling burnout. That's a major amount, and it seems to be moving up. I've just seen, will these slides be shared? Yes, we can definitely share these slides. Also, this is being recorded, so you'll be able to look back on the video as well. Excellent. So in terms of what's happening today, actually only just yesterday, after I'd already submitted these slides, saw a new study from the Melbourne University, which showed that half of prime-aged workers aged 25 to 55 felt exhausted at work. 40% felt less motivated about their work prior to the pandemic. So this is a major issue, and it's causing a lot of exhaustion and burnout within the Australian public. If we look at burnout in particular, burnout is actually an occupational health disease resulting from chronic workplace stress. So with burnout comes feelings of depletion, exhaustion, increased mental distance from the job, so feeling negative or cynicism, and reduced personal efficiency, efficacy. So it's not just a word that's being thrown about. It is actually an occupational health disease, and we have to make sure that we're looking after it. There's so many things that go into burnout, like you can see on the right there. It's not just about workload, but workload is one of those major issues. Another bit of research that came out through Microsoft actually in 2021 was around meetings and having meetings back to back. So across the top there, you can see where we have back-to-back meetings without breaks. So not having those breaks, I guess that's another factor in that overload and that overwork. If you don't have those breaks between meetings, your brain can actually start to fry. And by the end of it, it's starting to totally fry and disassociate. Really what you want to be able to do is have some short micro breaks in between meetings, and you'll see down below, the forward below, actually show you how good the brain can actually function with just small micro breaks. So we've got to be really careful about not only the amount of workload, but also breaks in between. Now, when we talk about workload, it's not just about the volume of workload. And I've seen a couple of organisations start to look at policies for workload and how much work is allocated to different individuals. It's really difficult to start putting a line around workload because there's so many factors involved. So firstly, volume. You do have to look at volume. How much work is coming in? How many requests? How much work is there to do? But also you have to have a look at complexity. So some tasks can actually be quite complex, take a lot of time to actually complete or work through. We also have to take into account multiple tasks. So 1 + 1 doesn't always equal 2. 1 + 1 could equal 3, because moving from one task to another takes some time in itself. And the brain isn't great at doing that whole multitasking piece as much as people think that is a truth. Multitasking can't actually happen. You have to move from one focus to another. And research has shown it takes a couple of minutes to actually move your brain from one task over to another task. So be careful about multiple tasks as well. 1 + 1 doesn't always equal 2. Next is the emotional demands. So we have to be careful about some of those emotional demands that we have in the workplace, whether it be dealing with people on an emotional level about emotional issues, or whether it be just towing the line and doing things that might be against your own values, but you need to do as part of your job. Those emotional demands can actually have a huge effect on a person, on your thinking about what should I do, especially when it comes to aggression. And we're seeing a lot more aggression, especially from the public. If you're seeing that, there's lots of things that will be going through your mind about, what do I do in that circumstance? Should I have said something differently? How did I feel about that? You'll be constantly working through things and processing issues. So that creates a bit of a demand in itself. Communication overload as well, we have to think about, and that is becoming more and more of an issue in today's day and age with IT just coming in leaps and bounds. We've got lots of different notifications. We've got emails, we've got texts, we've got lots of things, even just on your computer popping up saying, oh, we need to do this, or you need to do that, or you need to restart your computer. Lots of different things popping in, wanting your attention all at once. So, I mean, there are some ways of actually being able to mute some of those notifications now. And we're doing a little bit more in that space now to help us focus. I know anyone who uses Microsoft Outlook, it comes up with an automatic focus time that you can opt into as well. So things like that actually will help, but it is a difficult situation, especially at work, but also at home. We'll have the same sort of things happening at home with multiple emails, with texts, with people being able to communicate very quickly with you. There's the always on culture as well. Some organizations are getting better at this, but now that we have mobile phones, we have emails, we have texts, there's a tendency to communicate with people, maybe outside of work hours. And that's great in a way. I think there needs to be some boundaries around that and some discussion around how to do that safely, but sometimes that can get out of hand. And so we have to think about that in terms of our workload as well. What's happening outside of the work hours that may also be contributing to work and that workload. Lastly is work addiction. So that's a new issue that's been raising its head over the last couple of months, really, with some research being done across the world around work addiction. And we'll go into a little bit more detail about that. So researchers around the world are trying to learn more about this issue of work addiction through this major survey of workers from about 60 countries. And one of the lead researchers, a Polish behavioural addiction expert, said that addiction was a compulsion to work, something he estimates to affect 1 in 5 workers or so. And if you compare it to other well-established addictive disorders like gambling or video game disorders, it's actually much more prevalent than that, they are finding. So he also said that people addicted to work experience have withdrawal symptoms, including anxiety, physical discomfort, irritability, loss of control when they try to stop working on the weekends or holidays. And we are doing a little bit more research in Australia as well. We've got Dr. Rachel Potter from the University of South Australia, who's leading the Australian research on work addiction. And she said the preliminary results have indicated about 30% of the Australian workers are showing high risk or at high risk of work addiction. And they say that females and females are more likely than males to be addicted. So something that's coming through as well. And with work addiction, that can help to add to that workload as well. If you feel like you can't stop, if you feel like you can't have that break, then you obviously you don't take that break, and that will add to that overwork as well. I've got a question in the chat. Why do you think Australia has such high burnout rates, even higher than the US, which has a high hustle culture? Yeah, I can't quite tell you. It's going to be a range of issues, as we've spoken about. It could be to do with the type of work that we do in Australia. It could be the complexity, it could be the emotional demands that we experience. It could be that always on culture that we do have in Australia as well as the US. So it's an interesting thing. It's something that we will be watching over time, and something that really need to be keeping aware of. Okay, so something that I do need to stress, no pun intended, is that not all demands will result in stress. It's great to have a sense of challenge where you're feeling supported and you've got the resources. You can actually feel energized, you can feel motivated to continue on with work. And that's fine, unless you don't really get that match of resources to be able to do the job. And where we see that mismatch of resources, that's where we start to see poor health, illness and injury at work. We also know that for employees experiencing low levels of job control, high demands and job insecurity, they actually have a greater decline in mental health than compared to people who are unemployed. So it's better to be unemployed than to have a job where you're feeling those high demands, that job insecurity, and that loss of job control. So I did want to quickly touch on the legal obligations, and this is the only legal part of the presentation, but we do all have a responsibility to manage this. For the employer, within the workplace, they are responsible for eliminating or minimising those work-related risks where possible, taking reasonable actions to prevent and reduce harm where possible. For employees, employees need to reasonably comply with instructions on health and safety, cooperate with policies and procedures, and take reasonable care. So it is something that both employees and employer need to take care of, and we'll go through a couple of ideas for you coming up next. So the solutions. In talking about the solutions, we just need to make sure we've got the context right. And we talked about making sure that we've got a really good balance between not only the job demands, but the job resources as well. Because we know that the job resources will help to buffer those job demands and go towards your psychological health, which will have those possible health outcomes. So that top line there is what we call the health erosion pathway. If we really want to focus on our health, you want to be focusing in on managing those job demands that leads to the psychological health, that leads to those outcomes. The motivational pathway is the job resources piece, and that mainly leads to that engagement piece, which leads to productivity and outcomes as well. So just in terms of that, we also know that there are psychosocial climates or lead indicators that have an impact on your job demands and job resources. And when I talk about psychosocial climates or lead indicators, we're talking about things like senior management priority. We're talking about leadership trust, so the trust between leaders and workers to manage psychosocial safety. We're talking about worker confidence to put their hand up and say something is wrong, or I need help, or you've promoted me to an area where I don't know what's going on. Also, worker participation. So workers feeling that they can actually participate in the systems around health and safety in the workplace. So if you've got those lead indicators, you're more likely to have a good balance between the job demands and the resources, which will lead to the good health outcomes. So that's just a bit of context. We'll go focusing a little bit more on that workload piece now. So what I want to introduce you to is the psychosocial safety hierarchy of controls, put together by my colleague, Dr. Tessa Bailey, and her colleague, Professor Dollard in the University of South Australia. They've come up with this hierarchy of controls to help with a bit of a gap analysis of pretty much any psychosocial risk that you might, or hazard that you might see in a workplace. And what we'll be doing is going through this in terms of workload. And so when we look at the very top, we look at board directives, policy development. It's those high policies and procedures that we talk about. The next level is looking at human resource management, looking at the systems that we use within the organisation to manage these psychosocial issues. We then look at leadership practices to enact those procedures. So what are at the leader level? What can leaders do? Have they got enough training to be able to manage these issues? Also then job demands and resources and supports, what can we change about the job design? And then looking at workers, what can workers individually do to manage those psychosocial risks? Just looking at one of the questions that have come in, Does the study you mentioned correlate work addiction in women to the perceived glass ceiling? No, Anne. Good question. That wasn't something that came up in the research. And also Jane has said, can we please define what constitutes reasonable efforts? It can be a grey area at times. Yes, definitely. We will be going through a couple of practical examples of what this looks like. So we will definitely go through that. Okay, so this is a psychosocial hierarchy of control. You can use that on any psychosocial risk or hazard. We will be looking at it specifically around workload. So these are some questions that you may want to ask yourself in terms of, are there things at that senior management level that we can do to improve workload? So is there a policy regarding workload, and is it communicated to employees? Do organisational policies promote reasonable demands and adequate resources? Is there top-level management for creating balance between well-being and productivity? Is recovery prioritised? I think that's a big one as well. And whether it's proactive as well. If we're prioritising recovery, we're thinking about it beforehand. We're actually saying, well, we know we're going to be going through a high level of workload. Let's start to put in place where that recovery is going to be. Do senior leaders have indicators for psychological health and safety? I don't know many senior leaders that have KPIs around psychological health and safety, but it might be something that will be coming in, especially with the regulations coming through. So these are some questions that you might want to ask at that top level. At the second level, organisational development, that HR level, are employees fully aware of the policies around workload? Is there a system to identify workload or underwork? Are there clear methods for employees to report issues? Is there a good system? Really, this is what we're looking at. Are there systems that employees can actually interact with to make sure that they can let people know that there are issues within the workplace, and that something actually happens from there. Level 3 is around leadership. So are leaders promoting and supporting balance between productivity and well-being? Are leaders modelling that behaviour as well? And are they appropriately trained? I think that's a big issue these days, is the training of leaders. A lot of leaders will be promoted because of their ability to operationally do the job, and sometimes aren't given the right supports to be able to lead people through, especially issues like psychosocial risks. So making sure that you've got some good training around that, making sure that you've got some good training around some of the risks and hazards that are popping up in your own workplace as well. So if workload is an issue, having some training around workload and how to manage workload and deal with workload and help your team to manage that workload is definitely advised. Lastly on there is leadership behaviour for managing workload assessed as part of the performance and or promotion. So again, is it a KPI for leaders to be able to do that correctly? Job design is the next one. So are there redundant activities that could be removed from the workload? We all know about red tape or beige tape, as some government departments will call it. Are there things that we don't need to do anymore that can be removed from the workload? Do the resources match the demands? Are they accessible resources as well? Making sure that people have the right tools to do the job is a big issue. Are there proactive strategies to address highly demanding tasks and services? And is recovery prioritised and emphasised at that job level? Can we actually build that into the job? Level 5 is the worker level. And so this is the individual level. Are individuals aware of the responsibility? So making sure that they are aware of that responsibility. And my slides have just disappeared for some reason. I'm not sure what's going on there. Apologies for that. Sorry about that. So what I will do, I will try to get that back. Up and going for you. Okay, I'm not sure what happened there. Okay. So lastly, at that worker level, so are individuals aware or utilising those resources and support? So they might be there, but are they actually using them the way that they're supposed to be using them? Are individuals using appropriate processes to report workload issues as they arise? Is there that possibility for them? And are they actually doing that? Are individuals contributing to designing safe systems of work? So giving workers a bit of a say in how it actually works. So there's lots of different questions that you can ask there. Hopefully that will give you a bit of an idea or an idea of actually what you could do in your own workplace. And what I want to do now is go through some of the examples that we've seen through our work at the OPUS Centre in organisations to manage workload, both underwork and overwork. So at the top left-hand corner, we've got the stop, pause, go. So stop, pause, go, and many of you may have seen this before, but it still works for a lot of organisations. It's about what can we stop at the moment? Excuse me. What can we stop? What can we pause? And what can we continue on with? And just really simply, especially when someone is feeling frustrated with the amount of work, they're feeling overwhelmed with the work that they're doing, being able to sit down and go, okay, well, what can we stop? What can we pause and what can we go on? Helps people to really prioritize what they need to do, and hopefully will reduce that overwhelm as well. Second is creating boundaries for your work. And this is especially where you've got that always on culture in the workplace. Having a great discussion just around, well, what do the boundaries look like? You know, we all need that space to be able to turn off, to be able to spend time with our loved ones. And I'm sure that was a good message from the previous session, the previous webinar, around making sure that we do have those good connections at home. So we want to make sure that we've got that time for that. So where can those boundaries be? I know in France, it's actually against the law to send emails outside of work hours. You can actually be prosecuted for that. You don't have to go that far. We would rather that you have that discussion and come to some consensus around what those boundaries look like. We've also seen many organisations put workload on the agenda. So making sure right up front that we talk about it. If it is a hazard, if it is an issue within the workplace, talking about, okay, so where's your workload at the moment? Is it at a 5? Is it at a 10? Do you need help with prioritising your workload? And making sure that you follow up with that, especially as a leader or as a manager, making sure that you provide people with the assistance. Strategic pause to reassess workload. So this was happening, we found, in health settings. So where a surgeon was feeling overwhelmed with the work that he was currently doing or she was currently doing, they were able to take 30 seconds, take a breath, reassess what needs to happen, and then go back into the task. So that was okay to do that. And we've started to see the same sort of thing happen with our manufacturing clients as well, where somebody on a manufacturing line, if they're feeling stressed, if they're feeling some even physical discomforts, they're allowed to stop, take a 30-second break, and then get back to work. So being able to do that can actually help give you that little bit of buffer, give you that little bit of rest, so you're not feeling that overwork. As we talked about before, co-design. Co-design is definitely a great way to go when it comes to dealing with workload. If your workers are closest to the work that happens, they're going to know the best way, the most efficient way to get that work done. So making sure that you're working together on that workload. At the bottom there, we've got sharing appropriate resources to manage demands. So where you know things are working really well in your part of the organisation, in your team, sharing that with others. We're starting to see many more organisations do that sharing, where a team is doing a great job, sharing those ideas with other teams to see if they'll work there. Admin assassins. We saw this in one of our I'll just say organisations. And so what they decided to do was have a look at all of the admin that goes along, all of the red tape that goes along with the work that is done, and basically get rid of things that aren't needed anymore. So they went through and basically ripped up many different bits of admin that people don't need to do anymore, which actually reduced workload for people, which was great. So if you're able to do that, if you're able to do an initiative like that, maybe admin assassins isn't the way to term it. You might want to use something a little bit more comfortable, but yeah, this is what they did. So that's another opportunity. Another organisation that we worked with were proactively scheduling recovery. So they had some major events on at certain times of the year. They knew that at event time and before event time, all hands were on deck. Nobody could really take time off. There wasn't going to be any recovery even during that time. They knew that the workload was going to be high. But what they started to do was be proactive about managing that, be proactive about putting in recovery beforehand, afterwards, and during the actual event, if possible as well. So thinking about that before the event helped people to see a little bit of a light at the end of the tunnel, but also helped them to balance their health out with the productivity as well. Another piece is the creating the third space. So we're seeing that come up a lot more these days. Now, the third space, for those that don't know, is that space between work and home. That usually was basically the commute. People would be either reading a book or listening to a podcast or listening to music, having some time away from work, getting back into the zone for good relationships at home. We're not seeing that as much these days because of work from home. And so we have to be a little bit more focused on creating that third space. And we started to see people especially if they're working from home, they might, to finish off the workday, they might actually go outside, do a bit of a walk around the block and come back inside to help them with that third space. But we are also seeing other organisations putting in place some things in the tea room so that people have a bit of a third space during the day as well, where they would put in like a puzzle in the tea room. So people could actually go in, just tune out of work for a little bit, give the brain a break, do a bit of a puzzle, and then go back to their work. So it's just creating that space between thinking about work, thinking about home, and yeah, even between work as well. So that was great. And last one there is about clear expectations around workload. So it was really interesting. When we go into organisations, a lot of the time we will have what's called an action planning meeting, and we'll bring everybody together, a bit of a workshop to understand what the psychosocial hazards are and how we can improve on those. So this particular place that we went to, it was a car part manufacturer, and the workers were really upset about the amount of parts that they needed to do each day. So they would come in, they'd see a dashboard at the top of their workstation saying how many particular parts needed to be created. And so they would come in knowing that a couple of people were off. This was during COVID time, knowing that they couldn't make that number. And they were stressed straight away. one, knowing that they couldn't make that number, but two, having a dashboard there for all to see that they couldn't make that number. When we talked to management about that particular issue, they said, well, no, we're not expecting you to make that number. That's a black box number. It's okay. We understand that people are away. You make what you can possibly make. And by the end of the discussion, we had agreed to take down the dashboard and set some really clear expectations around what is actually the number that needs to be made every day. So sometimes it is just about having that discussion around what the expectations of workload are. And that's worked really well in different organizations as well. Okay, so that's a couple of the practical ideas that we've seen work in organizations. What I want to do now is have a little bit of a discussion with you and ask you what's worked for you in the past, or even currently, what are you doing in the workplace to help you to manage that workload? And I'm just going to read a couple of these chats. So current state of play: listening to webinar, typing work, email, replying, eating text. Next Zoom is in 19 minutes away. Yeah, it doesn't sound like you're getting a lot of relaxation there, a lot of breaks there, and it is about creating that boundary. You know, some people I've seen have started to block in some time for lunch in their diaries to make sure that they actually have that time and nobody blocks in time over the top of lunch. Just reading through, promoting breaks between meetings, great idea. I have heard that within Outlook, you can actually set the default meeting period to be 5 minutes rather than the 30 minutes. You can make it 25 minutes, or rather than an hour, you make it 55 minutes. And that can actually be automatic, so that you have that 5 minutes at the end of a meeting to go from one thing to another. Maybe even go to the toilet, heaven forbid. Great. Prioritize and get support from my team. Great. Meeting free Fridays. That's amazing. That's a great boundary. Making sure that you've got those Fridays free to be able to focus on things. I walked away from a toxic workplace. Sometimes it's the only solution. Sometimes it is. Unfortunately, we're seeing a lot of toxic workplaces around. You do what you can. We use the app Headspace app and ask everyone in the office to spare 4 to 5 minutes for a meditation. That's amazing. And that shows real commitment from management, from the leaders, to put resources and time aside to prioritize your well-being. That's fantastic. And as I was saying, that senior management priority is one of those lead indicators, which will then lead to those good health outcomes. Moving away from my desk for lunch, yes, great idea. Getting, not being able to see your emails popping up, not being able to hear the phone, not being able to have those discussions with colleagues, actually having a good break away from everything is a great idea as well. My Outlook says lunch, do not schedule for 1 hour every day. I never have a problem with colleagues booking me when it's clear like that. Okay, great. Shorter meetings and no meetings before 10 or after 4. Fantastic. And that's great where you can do that as well. We have heard of organizations, or teams, I should say, where they've said you can contact us between 10 and 11 or 3 and 4. Otherwise, send us an email, or you can do it the other way around. Only send us an email between this and that. That's the only times that we're going to be checking our emails. Otherwise, if it's urgent, please give us a call. So that's a great idea. Walk to get a coffee during the break, gets you away from the building. Fantastic, well done. Have a well-being room to relax and go for lunch as a team. That's fantastic. If you've got a well-being room, that's amazing. I've also set up a free Calm accounts for our employees. Not for everyone, but those who use it really appreciate it. I think that's another interesting piece as well, is that not everybody is the same. what works for one person may not work for another person. And you have to find many different ways of being able to balance that productivity with well-being for people. And so trying different things, trialing different apps or trialing different interventions is definitely going to be the way to go. Let's have a look what else. We use Perkbox, which has a wellness platform for staff to access. Fantastic. Coffee catch-ups, Friday team lunches, have a well-being team, fortnightly massage days. Oh, I want to work there. So that sounds great. So it sounds like there's lots of things happening. And I wonder how many of you actually have a wellbeing strategy that actually has all of this in there, or is it something that's been created organically from the roots up? I leave work at work and start afresh the next day. That's fantastic. Well done. Wellbeing day, great. Always good to put time aside, resources aside for well-being. Letting people know that if they want to call a meeting, they need to send through a prior email stating purpose, agenda, and outcome. That's great. That is great. So making sure that your meetings are actually useful. Calling meetings where meetings are actually required, and just having a phone conversation where you don't need a meeting. Working out at the gym, that's a great individual intervention, making sure that you have that physical health, and that'll also lead to that mental health. Now, WIP, W-I-P, working, hopefully someone can answer that one for me. What's WIP? It's an interactive process, so we change as the team needs. Great. Just a few questions in the Q&A section for you as well. All right, let me just have a look at the Q&A. Okay, so we've talked about proactively scheduling recovery. So making sure that you've got that time. So the question is, can you please give some examples for proactively scheduling recovery? So yeah, making sure that you've got that time before and after where you can actually have that recovery, whether it be a day off, whether it be a half day, whether it be meeting free days. It's going to always depend on your work, your workplace, and what you can actually do. So it's always good to have that discussion, have that consultation around what that could look like in your workplace. The alternative to admin assassins, time and motion study for staff to complete so they can see where they spend their time. From here, you can assess with them what is value add and what isn't. Great. Then cull some tasks. I think that's a great one, Karen. So you're taking some time to just study what does the process look like for individuals? Where is the time being taken? You know, and you've got to be careful not for that to create another demand on people, and you know, wanting to measure that for a long period of time. You want to do that in a short period of time, and move on with doing those cullings. So well done, thank you, Karen. And Runa says, are there any data on culturally diverse organisation, employers, employees? Good question. I haven't got any data for you, but I will look out for that. If I do find something, yeah, we'll try to put that up on our website, which is the www.opuscentre.com.au. Thank you, Runa. How do you not overwork and have enough time for rest and time outside your work when you take much longer to complete work than others? ADHD makes it harder. Absolutely. And that's something that you do need to discuss with your manager about the time it does take to get certain pieces of work done. I think it's not just about people maybe with ADHD, but everybody has different capacity to work, and your capacity can change over time as well. So it's really important to have those feedback initiatives where you can have that conversation with your manager. If you're feeling overwhelmed, if you're feeling like you don't know what to prioritize, that's the first step, having that having that conversation about, this is where my capacity is at the moment. This is what I can do. This is what I can't do. And coming to some sort of consensus about what should be done. Okay. Are there strategies for reducing expectations that you've set by being too helpful? How do you pull back to manage your workload when others have learned to rely on you? I think it is about a change of perspective, Alison, and you sound like a very helpful person. You really need to understand sometimes that the best way of helping people is to help them to help themselves. So it is about mentoring, starting to mentor people rather than doing the work for them. And it sounds like you know how to do the work, you know how to do the work well. People come to you, and it's about asking them those powerful questions about, okay, so how would you go about this? How would you, where would you start? If you don't know where to start, where would you start? Who would you go to? What are the sort of resources that we could pull in for this? Asking them the questions, helping them to understand how to do things, rather than doing it yourself. It's really difficult to go from that person who does things for everybody to that being that mentor. But there's lots of different resources on the web, lots of different great YouTube videos as well around how to mentor people. And I think that'll be really worthwhile if you're feeling like you're doing too much, trying to get the rest of the team skilled up. And it's doing something that's great for them as well. So great. Thank you, Alison. Okay, just looking at the webinar chat. Work in progress. Excellent. Thank you. I've led our wellbeing strategy that covers 4 pillars: social, mental, physical, financial wellness. However, ROI is difficult. ROI is always going to be difficult. And we've found that if you don't have the right leaders, the right managers supporting that wellbeing strategy, it can be very difficult to get things through. But it sounds like you've got the wellbeing strategy up and running, which is great. In a former workplace, we had 15-minute seated massages during work time, but funded by staff once a week. Also reflexology. That's great. Staff funded, staff owned time, but employer workplace. Yeah, I think that even just giving time to be able to do that during work, that's great. The Pomodoro technique is meant to be equally helpful for ADHD as well. I don't know what the Pomodoro technique, but thank you, Tabitha, for sending that in. I have ADHD and I am very open with my team leaders in what I need, feel, and we adjust where needed. Fantastic, Lynette. Yeah, and that's what I hope, that leaders will be able to have a good conversation about what is required, whether it's ADHD or not. Everybody's, as I said before, everybody's ability to work changes over time. So having that discussion with your manager is fantastic. And I think we are just about done. How do you create more meaning and purpose if you don't do extremely mundane and tedious work that you're not interested in? I think that's something that you do need to, again, talk with your manager about to really understand and create that purpose. What is it? Why are you doing that work? Might be that you're doing that work to make money. Why are you making money? You might be making money to go on holidays or to support a family. That might be your purpose and your reason for doing that work. Sometimes if you can't find that purpose in the work, you might have to put a purpose or attach a purpose yourself. Fantastic. All right, I might hand back over. I know that we're running a bit late, so thank you so much for your engagement. It's been amazing, all the questions and answers. I really appreciate it. Some great ideas there, and I hope that you've all been able to take away a little something, if not just a little reminder to make sure that you are taking those breaks and creating that time for yourself. Thank you.
Thank you so much, Kevin. The topic sounds so simple, But I think the reason why we're all engaging with it is because we all know personally how complicated this topic is. And you've done a great job in highlighting both the complexity of this topic, but also in such a clear way that even for me personally, I'm more able to strategize for myself about possible solutions. So fantastic. Thank you so much for that, Kevin.
No worries.
Now, before we wrap up, I just got a few important links for you guys in the chat. The first thing I do want to highlight is that the feedback form for this session will be shared there. Your feedback is incredibly important for us, not just so that we can continue to improve these sessions we have designed for you guys, but also to help us continue to offer free initiatives like this into the future. It's only 3 short questions and it's completely anonymous. So thank you so much for taking a moment to fill that in. Otherwise, we do have a link both to Kevin's website at the OPUS Centre, as well as WayAhead's Workplaces resources that you can browse. You'll also find the recordings just there as well. Thank you again for being here. And I'll give you 30 seconds to take a break and run to your next meeting. Hope we'll see you all again next week. See you guys.